All right, let's get started. Welcome to the Working Bridges Innovation Lab. It's really nice to see familiar faces and some new friends have joined us. I know I've got a few messages from some of our partners that will join in a little bit later. And so that, if you see some folks come in, that is perfectly normal, and we'll get started. We have a really full agenda for today. And so I hope you took a little time to think about how employees' health needs may have changed or be changing, and different ways that we can work together to find innovations or explore new resources, and to talk about the things everyone here is trying, all of those things that you're trying to do and what your goals are as it relates to health. My name is Connie Beal. I'm Working Bridges Initiative Director. We have some of our team here. Some of the resource coordinators are joining us. I wanted to just give a couple of warm welcomes. If I was in person, I would likely give you big hugs as you came in the room. But I want to welcome our new friends from Northwestern Counseling and Support Services. So NCSS, we have Stacy Remillard and Lexi Benware joining our team. We launched resource coordination services with them in January up in St. Albans, and Haley Schreiner is their resource coordinator. Just happy to have you on board, so welcome. And I'm happy to also share with you that we'll be launching with Superior Ceramics in April. So Superior is a manufacturer in St. Albans, and so Lisa Bovat is now a new partner in the network. So welcome to our friends. I don't think Lisa's on the call right now, but she's joining a little late, so you'll see her, Lisa Bovat. So I have a couple updates. I'll save those till the end because I want to make sure we give a chance for everyone to go around the room, the virtual room. Well, you're in a room, so go around your own room, unmute, and share your name, your organization, and maybe just one piece of information about employee health and what's on your mind when it comes to your employees' health. So that's it, and we'll move right through. I'd love for everyone to know who's who. So I'm just going to start at the top of my screen and call on you. So don't move. Oh dear. All right, let's go with Twincraft and Elizabeth and Lisa. Go ahead. You're at the top of my screen here.
Okay. Hello, I'm Elizabeth, the director at the People Center here at Twincraft Skincare, and this is Lisa Ashley. I am the generalist at Twincraft. I would say, as far as employee health is concerned, it might sound kind of strange, but I think we're doing pretty well over here. But if I had to add something, is we belong to Marathon Health Center, which is in South Burlington, and I would say that's been a huge benefit to our employees because it allows them to have free access to medical care.
Thanks you too. And I appreciate you sharing that. In fact, at some point today, we could talk more about any of the strategies you're trying. Feel free to share those. That's a great way for us to learn from each other. Cindy, why don't you go next?
What was it that we're sharing about ourselves? I know where we work, but
yeah, where you work, and then what's top of mind when as it relates to your employees' health.
Cindy McKechnie, and I'm at UVM Medical Center. And top of mind is our hospital. It's so varied with the different type of employees, and we're trying to bring, this is hard to put into, we've got doctors and nurses, and we have remote workers, and it's just trying to problem solve with how we can bring wellness that's beneficial to the varied different workers that we have here. It's really tough.
Yeah, so that diversity is something that you
Yes.
think about a lot.
Yeah.
Thank you, Cindy. Jim, do you want to go next?
Sure. I'm Jim Brannon. I'm new in the Human Resources Department at Northwestern Medical Center. I've been here somewhere around 5-6 weeks now. So I honestly don't know a whole lot about what the health needs are. I have joined the wellness portal. From what I've gathered from within my own office, in fact, from the person who runs the wellness program, it's not extremely robust or well promoted. So I see some opportunities there. It's just I've got a lot of other
Yeah,
opportunities that are a little higher on the list of things I got to get done.
thank you, Jim. Welcome. This is your first
Thank you.
innovation lab too. So thanks for making time and joining us. And it is early. Yeah, you'll continue to explore this, I'm sure. And Chelsea, why don't you go next?
Hi, well, I'll start by taking this off briefly. As for our employee health, we are in an open office and trying to keep everybody safe. I'm Chelsea Sweeney, I'm from Garnet Health, and we're here to meet you all and do a presentation today. So excited to be introduced to this group and learn from you all what's working and not working for you.
Thanks, Chelsea. Amelia, you want to share next?
Sure. Hi, everybody. Amelia Bechtel, also from Garnet. We are excited to be here, and I know we've met a few of you in either individual meetings or through some of our mobile integrated health efforts to date, but excited to get some feedback from the broader group on what we're trying to do to enhance employee wellness in the workplace.
Thanks, Amelia. Dylan, go ahead. You're up.
All right, thanks, Connie. Hi, all. I am Dylan Boisford, and I'm at United Way of Northwest Vermont in Human Resources. Excellent question, Connie. I probably have 3 or 4 different answers, but I think what's top of mind right now for me would be, as it relates to health, would be ergonomics. I think that's a focus that keeps coming back in my role, and it's sort of where my energy is right now as it relates to employee health and well-being. So there's my response.
Thanks, Dylan. I just sat up a little taller. Thanks for the reminder. Everybody's adjusting now. Liz, go ahead. Liz Gamache.
Good afternoon, Liz Gamache. I am at United Way. I'm the Chief Development Officer, and I get to work with the Working Bridges team, and am so glad to see familiar faces and to welcome some of the newer faces to Working Bridges.
Thanks, Liz. Lexi, do you want to go next?
Sure. So I'm Lexi Benware. I'm the HR generalist at Northwestern Counseling and Support Services. And we just had Haley, our resource coordinator, join us a few weeks ago. And it has helped so much that we just want to keep making sure people have access and understanding how to get those resources. We definitely underestimated how big of an impact it would have. And it's been great so far. So continuing that would be great.
Thank you, Lexi. It's so great to have you at our lab. I'm really looking forward to the strong partnership. So we've really, it just feels right. So thank you. All right, Sarah, do you want to go next? Sarah Sterling.
Hi, Sarah Sterling, Human Resource Advisor at Northwestern Medical Center. I work with Jim, who introduced himself earlier, and I kind of share his same sentiments about our platform that we're using for employee wellness. And it's changed the last couple of years. I think each year it's changed. So we're kind of faced with new challenges each year, and we need to be doing a better job of just getting it out to employees and employees working remotely and employees just coming off, a big spike of COVID patients. So we just have a lot of people in different places and within the organization. And so trying to wrap around everyone's sort of the space that we're in right now.
Yeah, thanks for that, Sarah. Donna Ray, you're up next.
Yeah, sorry about that. I was on mute. Hi, Connie. I am with FabTech. I'm the Human Resources Business Partner here in Colchester. I'm going to be going off screen because I'm multitasking and my door is open, so I don't want to make anybody offended. But our biggest challenge is getting people to participate in our wellness programs. We have companies in Vermont as well as across the country, and I run the wellness program for everybody, and it's my biggest challenge is getting people to participate, whether it be a nutrition challenge or a walking challenge or a fitness challenge. That is my issue, is getting people to participate, even though I offer wonderful prizes because we're funded by Cigna. We have a wellness fund every year, and I can't impress upon people enough. It's like, if you participate, you will get a prize or a reward, and
Yeah.
that just doesn't get through. So I'm welcome to any kind of feedback or info.
Great, Donna Ray. That's really helpful to hear. Thanks. Shannon, why don't you go next?
Hi, everyone. My name is Shannon Purdue. I'm with Autumn Harpa Skincare and Cosmetics Manufacturing Company in Essex Junction. The thing that's on the forefront of my mind right now is access across language and cultural barriers. We have a bunch of folks who are non-native English speakers, and any kind of resources related to that are fantastic.
Yep, that's great. Thanks, Shannon. And Amy, do you want to go? Amy Lachelle?
Hi there, I'm Amy at Commando, and I think probably we have a lot of opportunity to formalize some wellness programs. Right now we do kind of an on-site yoga, but it's outside due to space, so that only can happen in the summer or when it's warm enough. And I've been looking lately at offering like a biometric screening on site through Cigna, so that's something we're looking at. But yeah, I think it's something we should be looking at, and it's one of those things that's kind of been on the back burner. So
Glad you could join us. Yeah, that's great. And Lisa, hi, Lisa Bovat. I see you on your iPhone, but go ahead, you're next. And welcome.
Hi. I just barely hopped on, so I only heard a couple of responses. I assume that you're asking what we have in place for health and wellness in our companies.
Yeah, name, company, and then what's top of mind as far as your worksite wellness goals and what employees need around health and health access.
Gotcha. So we just had a town meeting, and we do this monthly, and we just reminded all of our folks that through the Cigna program that they each get 50% off their insurance premiums if they participate in health and wellness. I don't know if that's been mentioned already. So that's one annual physical, one dental visit, remain or become tobacco free or go to tobacco cessation is what's sort of hot on our mind, because we just updated all of our benefits for the year. And we have almost 70% participation in that.
That's a really good number. Yeah. What do you think was the reason for such good turnout? I mean, it's the incentive itself. Certainly the reduction in the premium is a reward, but
yes.
What else worked, do you think?
We're pretty hands-on with our benefits package delivering. We do a lot of one-on-one discussing and reminding and making sure they have the paperwork that they need to complete. So it's it's a little bit of hand-holding, but it's successful.
Yeah, that's great. Thanks for sharing that, Lisa. So next, Lisa Ellison, if you're available, I'd love for you to chime in.
Hello.
There you are.
Hi. I am still pretty new at Rhino, so I can sympathize with the other gentleman who's 5 or 6 weeks. I'm going on, I think, 90 days now. But if I had my wish list of perfect things, I would do a month where it was really dedicated to a different aspect of the whole person. So whether it was mental health or whether it was dental, whether it was medical and doing biometrics, I think that'd be great, because then that gets everybody kind of in top of mind for open enrollment and managing those costs. We are self-funded, so there's that. I'm also looking at outsourcing FMLA. I don't know if any of you have done that before, but you can actually outsource the processing of FMLA so that the interactions you have with your employees are a little bit more meaningful, and all that icky paperwork, especially in the time of COVID, kind of goes away. So we're actually actively looking for vendors right now and trying to mitigate some of my staff's mental health issues around that subject with COVID.
Lisa, that's really an interesting approach. I haven't heard a lot about that. Would love to hear more about the research you find, like, and what you discover. I think that would be really interesting to share. Okay, thanks, Lisa.
You're welcome.
Okay, I think I made it around the room, and I think the only one, Christine, where'd you go? Christine, she was here. Oh, there you are.
Here.
There you are, Christine, go.
Okay, and thanks also to United Way and Working Bridges for having me today. So my name is Christine Griffing. I am with Vermont Department of Health, specifically with Burlington's district office. So each district has a local health office, whether it's St. Albans or Morrisville, Bennington, Springfield. So each office, I'll tell you just quickly, each office has their own chronic disease designee, whether it's someone that's part-time or like a Burlington office, we have several of us. So I'm on that team, and I was formerly at Northwestern Medical Center pre-COVID. That was pre-COVID times. We used to have, I know we did at one point have a pretty robust, very involved wellness program, which I'm sure has undergone some changes with COVID. When COVID's in a hospital, that takes the forefront, understandably. So nice to see some familiar faces, and I've enjoyed hearing about everyone's challenges and what's working well and ideas. So I look forward to sharing a little bit more.
Thanks, Christine. Yeah, Christine's going to share a little bit more in just a moment. I just want to connect our team, and Stephen, why don't you share, introduce yourself.
Thanks, Connie. Hi, everyone. I'm Stephen Berbecco. I'm Director of the Mental Health Initiative, which started at the beginning of this calendar year. And the goal is to strengthen timely access to appropriate mental health services for our neighbors. We've heard from many of our community partners that mental health is a priority. And in response, we're working to build a shared agenda with our partners. And that includes direct care providers, Vermonters with lived experience, associations, policymakers, and others who touch on the system of care to make sure that we're all helping each other and that the decisions that we make support each other to the benefit of our neighbors. I'm going to be doing a lot of listening on this call. And if anyone here would like to follow up and talk a little bit more about what you're seeing, your interests, and how we can work together, please get in touch directly or through Connie, however works best for you. Thanks, everyone.
Thanks, Stephen. So I will follow up with Stephen's information because this is a pretty new initiative, and my hope would be that you all feel supported connecting to Stephen in this, in as far as how you see mental health resources or gaps or supports being needed for workers and employees. So I think that'll just be, this is just the beginning of that conversation. So thanks, Stephen. Thanks for coming. I do want to make sure I give time for our resource coordinators to say hello. I see that Maya introduced herself in the chat, so she's with us today. She is one of our Working Bridges resource coordinators, and so is Kit Gallagher. So Kit, are you there? I know that.
I'm here.
Hey, do you want to introduce yourself real quick?
Yep.
Go ahead.
Okay, sorry. All right, here I am. Yes. Kit Gallagher, resource coordinator. I am at Autumn. I'm just eating a little lunch. That is my dog. Resource coordinator at Autumn Harp, Wake Robin, and Food Science. So been with the team for about a little over 6 months, and it's good to see you all.
Thanks, Kit.
Yeah.
And so let's just move right on. If there are just a couple points that I thought I would reflect on. I know. And I'll send this in the follow-up anyways, just to the point of language access and health equity. And so Shannon, you made me think about this. I started participating in a coalition called the Language Justice Project. And some of you may know of it or are connecting with them, but they've been focused on a series of films that, or YouTube films that can be shared in various languages. And they're actually finding a lot of success as far as helping Vermonters that speak a variety of languages be able to understand COVID procedures and vaccine offerings and ways to stay healthy during the pandemic. And they've, so I'm learning a lot through them. I'll share their links. And Shannon, maybe that's a resource that would also help with sharing information about health services and resources across language needs in the workplace. I'll follow up with about the mental health initiative. And then just as a reminder, I'll also send some information about a cancer screening survey that we have. It's specifically a barriers to cancer screening. We're partnering with Amy Brewer on just sharing that in workplaces. So for residents in Franklin and Grand Isle counties, this will be an opportunity for employees to take that and get a there's a grocery card giveaway. So I'll make sure to send that along. But I think the last part, I think now part of our time together was really being able to focus in on state level resources and just really trying to get a clear idea of like what resources are available for worksite wellness programming. And so I'm going to hand off where are you? Christine. I'm going to hand off the mic anyway to Christine Griffin so she can share a little more about what the state's resources are, maybe engage with some, just to have some discussion with you about the way to interact with the health department. So Christine, why don't you go ahead and
Thank you, Connie. So thanks again for having me today. So I've been with the health department, let's see, about 9 months now. And I'll be honest, so I know probably most of you are in the same boat. I was deployed pretty much immediately to COVID response when I joined in the health department. But before that, I had many years of worksite wellness experience. And in my current position, my focus, even though there's several chronic disease specialists in my office, my focus is on work sites. So I am here Burlington District Office to support worksite wellness efforts. That could be anything from helping a small business kind of get their feet off the ground and start a wellness team. It could be helping a larger company. We worked a little bit with a larger company who sort of had the ideas of worksite wellness, but really just needed to kind of focus their efforts on what those first steps would be. And then also supporting businesses who have robust programs and maybe just need to revisit what their program looks like, who their audience is, and how to reach them. Knowing that probably most of us, and you can put your hand up if I can see you, if your employee wellness program needs to be revisited now after changes in COVID. I know ours, a lot of us are working from home. So, what does that look like working from home, and just some of those challenges that we all are experiencing right now. The other thing is, if you're on this call, I'm assuming that you are already either thinking about worksite wellness or you are one of our leaders across the state in worksite wellness. So I applaud all of the efforts for all of you doing the work that you're doing, especially in these hard times right now. And I do recognize some of the companies that I know that we've worked with, whether I worked with them at Northwestern Medical Center or we've worked with them through the Department of Health. And so just a big thanks for supporting your employees day to day, making work fun to come to, and reducing our chronic disease throughout the state of Vermont. So I'm going to stop sharing my video. I'm just going to pop up. I'll admit I'm not a Zoomer. We usually have Microsoft Teams, so hopefully I'll get this. Hopefully I'll share my screen successfully here. Just have a quick, a couple slides basically about resources that are available through the Department of Health. And this is statewide. So like I said, even though I'm in the Burlington District Office, each district has someone who's dedicated to worksite wellness, who's always, even when we're deployed to COVID, we're always, willing to come in and step in where we can and help. Whether you want us to be more hands-on or hands-off, it's up to the company and what their needs are. So I'll show you at the end also how to get a hold of each district office's dedicated employee. So I'm gonna stop here. And okay. Okay, can everyone see my screen?
Yes.
Okay, great. So like I said, again, my name is Christine Griffin, and I'm a chronic disease program specialist in Burlington District Office. So most of you are already familiar with our 3450 campaign. 3450 is basically focused on 3 major behaviors day-to-day habits, including physical activity, diet, and tobacco, that lead to 4 diseases that we most commonly see in Vermont that lead to death, 50% of death, and that's including different types of cancer, heart disease and stroke, type 2 diabetes, and lung disease. So I'm going to give you just a little bit of a tour of the website. I know everyone's probably more familiar than they would ever want to be with our website after COVID. I shouldn't say after. As part of COVID. So I'm just gonna give everyone a little tour of where they can get some of these resources for themselves. This is our 3450 page. Definitely lots and lots. If you've ever taken some time to do a little deep dive into what we have available on the website, aside from COVID, there's a lot of information here. It can get a little overwhelming. So for Worksite Wellness, we have pretty much all you would need to get started, or for businesses who have stepped away during COVID, if you just need to refresh kind of where am I at, what should I be focusing on? Or if you have new employees that have come into your Worksite Wellness program, this is also a good place to have them revisit just to get them started. So this is our Worksite sign-on for 3450. If you have not already done so, feel free to take some time and look through that. And I'm going to send the slide deck over to Connie so you can quickly access these links afterwards. There's also toolkits. These are pretty robust toolkits to getting started, and it includes anything from promoting physical activity, creating a breastfeeding friendly work environment, and so on. And let's go a little bit more. This is a little bit more. So I did hear some concerns around different occupation. I know myself when I was working at the hospital, exactly what I heard was that when you have you have your IT department, you might have clinical staff who are in scheduled clinics, but very busy. If it's primary care, urgent care in the ER, have a totally different schedule versus your nurses on the floor. It's hard to, and then also you're working 24 hours a day. It can be hard to reach all of those employees. So we do have occupation specific wellness resources, and this includes anything from help with industrial type businesses to trucking. There's some excellent information there. And as always, going tobacco free. This is resources on not only setting policies, you can get signage for your property if you want to update your tobacco policies to include substances. A lot of businesses now that they're seeing more vaping, make sure that your tobacco signage and policies include any vaping products as well. This is a big one right now, supporting emotional well-being of employees. We know that supporting emotional well-being of employees, not only just using EAP, but physical activity promotes well-being, eating well promotes well-being. So really taking a broad look at different ways to support your employees, especially right now when everyone's maybe already been burned out, coming back to the table, and now there's a little light at the end of the tunnel. It might be a good time to really jump in and help them through these next few months. For those work sites that have attended our Worksite Wellness Conference in the past, we used to have a nice big on-site conference, which has been moved to a virtual conference. There are lots of work sites and workshops, lots of workshops here that are available if anyone wants to take some time and look at these. They're great videos with a lot of really good information. The other one, so we all know, and I wish I had some data on this right now, we are starting to dig through the past 3 years of data right now to come up with some numbers on just how affected preventive care visits were across the state of Vermont. Once our analysts are out of COVID world a little bit more and able to jump on that, I know teams are ready for that, to learn how much was affected. And one of the main strategies of preventing and managing chronic disease is obviously getting regular checkups and having a good relationship with the primary care providers. So I heard some of you saying, I know when you have on-site, was it Cindy that said maybe that, and Cindy, you can correct me if I'm wrong, that you're using Marathon Health. That's a great way to not only have care for your employees there on site, but then also encourage them when necessary to visit with their primary care.
I think that's with Elizabeth and Lisa.
Oh, okay, Twincraft, yes,
Yeah.
thanks.
Yeah.
Thank you. These are some additional programs. So again, looking at chronic disease management and prevention, these two, the My Healthy Vermont workshops are wonderful workshops. They were Vermont Department of Health and Blueprint, and I believe right now they're shifting under Department of Health. I will just click on here. So these are great workshops that you can point your employees towards. They are pretty robust. As you can see, if you've never visited this page before, this is great for to just take some time and click through. So chronic disease management, chronic pain management, diabetes prevention and management. These are excellent free workshops for your employees, and a lot of them are online. I believe all of them are online right now. So definitely point your employees this way and help them manage some of those day-to-day challenges. And the You First program. So You First provides financial assistance to cover breast and cervical cancer screenings, also with diagnostic follow-up. And You First does have an eligibility requirement to meet income guidelines. So if you do have employees that might meet those guidelines, this is an excellent way to resource to push them towards to help them get those screenings, which we know a lot of people, probably myself included, have missed over the last couple of years, just those regular checkups that we all need to go back and revisit. And COVID support. I did just want to show one thing on here. I know you're probably all quite versed on our COVID vaccine, our COVID pages. But one thing I know that as we're still just kind of rounding up the last employees to get vaccinated, if you do have employees who are English language learners or English is their second language, we do have resources down here at the bottom of the page in different languages. These are our most common languages that we see. And if there is a language that you don't see on there, that you have an employee that needs some information, please feel free to reach out and we can try to get that for you. There's both fact sheets and then there's videos that Dr. Andrea Green has done with our interpreters with AALV, which is African Americans living in Vermont. And they have done a lot of work to get information out about vaccines and address any hesitancy. So this is a great resource, especially for HR if you have a vaccine requirement or are trying to boost your vaccine rates within your business. Those are excellent resources, and they're in English as well, but those are just great. And we actually use them quite a bit. And anything else? Does anyone have any questions that I can help with? I have a couple of questions. I'll just put this back up on the screen. I would like to know what, if any, if anyone wants to pop off mute, if there's anything that Department of Health can either help with, or if there's anything specific that has been challenging for you. I'd like to hear what challenges you've had. Additional challenges, I guess.
Feel free to use the chat if folks would rather know, if there are things that would be helpful. Go ahead and share.
And while we're doing that, I will actually show you. So like I said, I'm with Burlington District Office, but if you are not in our catchment area.
Yeah, we cover the tri-county, so it'd be Franklin and Grand Isle as well.
So when you go to your local health office page on the PDH website, and you go to any of our staff lists in each site, once you click on a site, like if we go back up to Burlington, I'll just show you where you can find all of us. Although even if you reach out to me, I can always redirect. So each site will have your local chronic disease program specialist listed on there.
Yeah.
And my phone number as well, which I forgot to put
include both in the follow-up email. And I think you were right in sharing that. I mean, it's true. Most partners on the call right now have really strong wellness initiatives. And wellness these days seems to be like this changing thing, right? And it means something different to different people, right? Different positions, different experiences. I guess everyone's wellness wheel is made a little differently, right? Animal crackers and a walk keep me well, right? What keeps you well? And I think as our partners are learning about maybe these changing needs and identifying gaps, right? I think of your work, Christine, in this state as a really great resource to be able to share, like, hey, this is a gap we're seeing in access or in equity, being able to make sure all of our employees have the resources they need to be well. So I really appreciate your time with us, and encourage partners to reach out directly to Christine, and we'll make sure that folks have your details. So with that in mind, as you're looking at your wellness plans and your goals that you have to keep your people well, we Working Bridges had the opportunity to connect with Garnet Healthcare in this space of trying something different, right? Trying to learn how people are increasing access to healthcare services and making it something that is literally hard to miss. You kind of have to walk right into it. And then Amelia and Garnet, they're really in that space right now. It's a really interesting work that we've learned about through Garnet, and seeing the work happen with some of our partners. So Amelia and Chelsea, if you'd like to take it away from here, I'd love for you to be able to share what Garnet's doing and why, and just kind of give the team a little more of a sense of the space that you're working in and the directions you're headed, and strategize with the group. So go ahead. Thanks for commenting.
Thank you, Connie. It's so great to get a chance to chat with everyone today. I'll start by giving, and Chelsea can feel free to jump in at any point if I gloss over something, but I'll give you kind of the 30,000-foot view of Garnet, just as a little bit of background, and then tell you a little bit more about some of our current work that we're doing with this idea of meeting patients and employees where they are, and thinking about how we can leverage kind of that workplace as a platform to deliver our healthcare services. So Garnet was founded originally in 2019 as a patient transport company. We were doing interfacility transport, and about 6 months after our launch, COVID hit. And the company was able to pivot and really step up to leverage our clinical logistics infrastructure to meet some of the COVID needs for the community. So I imagine some of your companies may know of us through those efforts, whether it be testing or vaccines. We've been really focused for the last 2 years on stepping up to meet some of the pandemic needs and deliver those services around really the entire state. We're headquartered in Chittenden County. And as we started to think about what else we could do, we've been kicking around for a long time this idea of mobile integrated health. And for us, what really drives us as we think about our role in kind of the healthcare landscape is, how can we be innovative, and how can we innovate on, healthcare delivery, which is always a slow moving industry. How can we improve access for our community members to good, high quality healthcare? And how can we help our partners to achieve health equity and really, step up to make sure that everyone's getting the care that they need? And I'll also see if I can just share my screen as well. So as we started to think about how we could do that, we have sort of a slew of services that fall under this mobile integrated health offering. And we have sort of two approaches that we're taking, and one is working with partners in the workplace to bring these services on site where employees are. We know the concept of mobile integrated health has been incredibly effective nationwide in addressing social determinants of health. We know that already. So how do we do that in a way that in Vermont, where we can get in front of the people who need the care the most. And so we have a couple of core offerings that we talk about when we talk to employers. And those are, some of those have been mentioned today. So one is biometric screenings. We think that's a really important way for employers to get a baseline on their employee health. It's a really good point of access for employees to the healthcare system, where it's not a big commitment if we're there and they're taking 15 minutes from work to come and visit with our providers. And we took a little bit of a different approach, I would say, than some of the other vendors that provide, traditional biometric screenings. So while we do all of the same point of care labs and vitals and, height, weight, et cetera, we also include counseling for patients in that moment, right? So we do counseling at that point of care to include a mental health screening, which we think is so important. So sort of a take on biometrics that is more of a whole person approach, so that we can identify what those employee needs are, everything from what are the risk factors for the things we know are really, as you were mentioning, Christine, the things that cost us the most money, the hypertension, the diabetes, the heart disease. Of course, we can get some information and help stratify risk on those, but also mental health. Depression, for instance, is a huge costly issue for employers with absenteeism, employees missing work. So we've integrated a mental health component into our biometric screenings so that we can really get that whole person point of access for employees. And then we make referrals to primary cares or specialists as needed. And so we think that's a really important and nice thing. Another, aspect that we've all learned through this COVID pandemic is it's fundamentally changed the way that our employees are thinking about their role in the workplace too. What drives them to come to work? What are they looking for in an employer as it relates to benefits and culture? And we feel like this is a strong way for an employer to show that they are invested in their employee health and providing those opportunities. And the other offering that we have is an on-site mobile clinic. So we know, and TwinCraft is, as they mentioned, right? The marathon model is great. When you have an on-site or near-site clinic, that really helps improve access for employees to be able to get the care that they need and have that point of access. It's not feasible for all employers to have that on site. There's a lot of overhead that comes with that, and there's somewhat limited near site opportunities. So we also have the ability to bring that in a sort of mobile ad hoc capacity to employer sites. So let's say you wanted to set up one day a month where you offered an on-site clinic for your employees where they could sign up for appointments and be seen without having to miss work or worry about transportation to their primary care or secure childcare outside of work to get to that appointment. We can come and also have flexibility to do that across shifts. For those of you that have manufacturing facilities, we found that that's a big thing too. And someone mentioned the language barriers as well. We are able to offer our services with translation services so that we can really meet, all of those patients and employees where they are. So these are the offerings that we think we can really have an impact on the local, community. Outside of the work we do with employers, we have some other offerings that fall under that umbrella of MIH. So we have the capacity to do telemedicine. We can do mobile lab draws, pre-employment physicals. We're still doing a lot on the COVID front today with mobile testing and vaccinations. And we also have a arm of our business that focuses on workplace safety, which is slightly different, but somewhat related. So, we are, in addition to these things, also partnering with some of the other healthcare providers in the local ecosystem, some of the federally qualified health centers and primary care is where your employees may be going today, to see, if we can partner to take our, help them enhance their services by using our mobile capabilities to deliver those to communities that need them the most outside of the workplace. So, what we wanted to do today was just sort of introduce the concept, let everyone know that we're really looking for, I would say, partners to help us, people who would be interested in maybe some of these offerings and working with us to help understand the potential impact. So, we're very open to doing things like, case studies, working with partners who want to help us to understand what we can do with, these mobile capabilities that we've built out, because we think it's a really powerful way to, approach that ultimate goal of health equity. So I'd love to hear if anybody has questions or how that aligns with some of your organization's thinking. We are open to feedback, and we're early enough that we will gladly accept feedback and incorporate that in how we think about what we're doing.
Amelia, what's the reach right now? So I wrote in the chat, what region can Garnet serve right now? Where's that area?
Yeah, we can currently serve the state. So our mobile, we have two sort of fleets of vehicles. We have our mobile labs and vaccinations are done through SUVs, and then we have a mobile exam room or 2 exam room clinic that we can roll around the state. So we are able to plan to be anywhere and happy and able to serve all corners of the state.
Thanks. Okay.
I'll also have Connie send out some follow-up information. We have more information on both the biometric screenings in our on-site clinics, as well as we have a little video from our medical director speaking to the clinical side of things that we can share with you after the meeting as well.
Stephen, go ahead. It sounds like you have a question, or I see your hand.
Thank you. And thank you, Amelia, for this presentation. I'm really excited to hear that mental health and substance use are part of the screenings in the biometric screening. I think that's fantastic that you offer that to the benefit of our neighbors. I wonder if you could speak to what sort of tools you found to be, or what assessments have been most helpful with those screenings, or are they more of kind of a check-in, like an informal conversation?
Yeah, so our medical director, she's an ED physician. And so part of her kind of triage process in the hospital is to do, some mental health check-in. And so she developed our list of screening questions.
Wow,
and
great.
we, it's been really interesting. That's one of the aspects that's been most interesting to me about the work we've done thus far, is just sort of the need for that point of access. I mean, these are 20-minute biometric screenings. And in that process, we have employees saying, hey, I have thought about suicide. That's crossed my mind. Or, oh, I really have a hard time, getting out of bed on the weekend when I'm, feeling down. And, it's amazing to me that those things, they're so willing to share those things in, a short appointment, where I think it's just that somebody's asking and that it is just kind of that check-in. And then we're able to, make appropriate referrals so that they can get, additional services as needed.
Fantastic.
Any other questions that folks have, or feedback, things that would be helpful on your wish list? Now's our chance.
I have a couple questions. And to start, you may have covered this in the slide, but at some point it looked like you'll be able to bill insurance as well, and that's coming this summer.
That's correct. We're currently in process with credentialing and should be expect to be fully in network with payers, you know, in the next 60 to 90 days. So previously we've been billing out of network for the engagements we've done, but we know that that's an important step for most folks to have us as part of the network. So we will absolutely be participating with all the major carriers.
Okay, and then as far as the referrals go and kind of what you were just speaking to, so if you are meeting with someone that you think they may need to talk to someone who's kind of going through a tough time, how does the referral process work? I know in Vermont sometimes it can be a little hard to find someone quickly. So would you work with the EAP system, or you have referrals that you use, or how does that part work?
Yeah, it's a great question, and one that I think we're still, part of the process we're still refining, because we've also found that depending on like who the employer is contracted with, or who owns the health plan, are there different processes for carriers to figure out resources that are in network, or are we sending those to the EAP or someone that serves a broader need? So I would say at this point, we have our own resources that we've built that we can refer to. We are also happy to follow your process if you have a preferred sort of network of providers or resource that you would want your employees to utilize for those services. And Stephen, we're interested to connect with you and figure out some of the ways that we can learn about what you're doing too.
And I think it's also important just to mention that through all of this, we're linking in with the primary care provider as well, and leveraging their network of resources and referral basis. If they have a primary care physician, we know that access to primary care physicians is challenging. So we understand that not everybody might have one, and we're happy to fill that gap if necessary. But ultimately, we want to, maybe identify the issue, circle it back with a primary care physician, and then fill in if needed.
Thanks, folks. Really good thoughts. I mean, I know Amelia and I actually met after a round of mobile clinics that I think that were hosted at one of the work sites. And I, as from the perspective of like Working Bridges resource coordinators, to have an additional resource as far as health access, whether it's on-site or near site, right? That idea of how are we dismantling the barriers that typically have kept people out of the healthcare system? Because the system itself is such a behemoth. It's really just this large thing. So I really love thinking about what are ways we can break those barriers, or kind of build off what exists, because we don't have to, we can work toward that. The system change, that's something that we need to do, as far as a network, right? Impact, we have, our collective voice has impact, and we will do that work. But in the interim, the need is here, the need is now. And so I love coming together to think about what each of you can do in unique ways that meet the unique qualities that your employees have, right? And health access these days, I think it's increasing. We're more aware than we've ever been. A silver lining of a pandemic, right? Seeing that we can create some change so that people have the opportunity to have better health. Our health shouldn't feel like a privilege, right? Being able to access health shouldn't feel like a privilege. So I thank you, Christine, Amelia, thank you for your time, and just really giving the team a good overview of what's happening in your space and how they can connect their work with you. And this will give us all good information so we can start to, build on these first conversations. Does anyone have other reflections, feedback, anything they'd like to share in these last 5 minutes? Otherwise, I'm going to give you a pee break. Yes, because I know you've booked yourself hour to hour, haven't you? Part of our employee wellness right now. It's so nice to see your faces. I'd keep you on 5 more minutes just to chat, but I know you're busy humans, And much respect and care for all of you. Stay well, and I will follow up with email. See you next time.
Thank you.
Bye, everyone.
Thank
Bye, everyone.
you.
Thank you.
Thank you so much.
Thanks, Connie.